Hi, we are students from ECPI in the Master's Program of Nursing on the educational track. And we are here tonight to discuss health promotion counseling recommendations for women. Our topics are going to be the HPV vaccine, pap smear recommendations, and STI recommendations. First up is Judith. She's going to tell us about the recommendations for each category. Judith.
Okay, I'll start out with for the cervical cancer screening, pap smear, and HPV infection. And for young women, one of the suggestions is that they begin their HPV vaccinations by the age of 11. Um, and as they do that, they should have their second dosage 1 to 2 months, and then the final
promotion should be incorporated with the parents' input prior to, because I know some females do develop prior to the age of 11, but I think it needs to be focused more with the parental education and the child education to be for that, firm base at age 11.
I'm in agreement with that because nowadays our children are just, they're learning more on the outside as well as in-house with us. And so we as parents need to be that first source of information. We need to be that first source of exposure to our girls about things of this nature.
But I think also the nurse can make an impact with that when the family comes in with their wellness visits or their school visits, because I know in North Carolina, we have to take my daughter, she has to get a physical every year for school. And she just turned 14 and she's in the 8th grade. And this is the first time that the doctor in North Carolina sat down with her and us and talked to her about the HPV vaccine.
Oh, wow.
And she's 14. And we were seeing her for the past 5 years prior to that, and he never mentioned anything about it. So, the questions she saw and what she was raised with and what she was exposed to, I think it would have been a better idea earlier. But with, me being an ER nurse and my wife is a respiratory therapist, talking to her was kind of put off a little bit because we were hesitant about trying to expose her to too much and having her shut down by saying, that's inappropriate or that's gross, or, trying to work with the school to see when they were actually having, I guess, I don't know what they call it now, sexual education, which I don't think they call it anymore in school, but health awareness or anything like that. I think it needs to be started earlier.
I do too. Okay, moving to the next recommendation, Judith.
The next recommendation is concerning pap smears, screening, and guidelines. And according to the American College of Obstetricians and Gynecologists, they feel the recommendation increasing the screening intervals for women ages 21 to 65 and ending at age 65. And typically, the first screening happens around the age of 21. Rationale for high risk, high rates of clearance of HPV. Then women ages 21 to 29 every 3 years with cytology. Women ages 30 to 65 screen every 3 years with cytology of 3 consecutive negative screening tests and no history of invasive carcinomas. And women with hysterectomies, they would have a screening annually for 20 years until they disease. Women greater than 65 for negative screening cytology tests in a row, no abnormal test, they would go to no repeat for that.
Okay, well, when it comes to the pap smear, I know because I'm not sure that the recommendations are maybe the same for women who have had hysterectomies, because I know I had mine fairly young, probably when I was about 29. And now at first I started off with every 6 months. Every 6 months I had to have one. And then it was yearly. But now that I'm almost 50, I haven't had one in the last 2 years, but I go to have one, but they never say that it's needed. So I'm not sure as to whether or not physicians are always following that protocol.
You kind of froze a little bit when you were when you were talking about going to the doctor. We kind of froze a while when we lost you.
Okay, so how much of it did you hear?
The first 2 minutes, and then you froze, then you captured back a little bit, and then that was it. You mentioned that you go to the doctor every year, but they don't do the exam. They don't do the
Right.
the pelvic test, the pap smear test.
Yes, I've only been getting it probably now every 2 years. I'm not sure why that is. That's why I'm saying I'm not sure that all physicians are following the recommendations, or are they just going off on what they feel and leaving it as that.
But I think the way things are going now, you can track all these trends with the CDC. I think it would be something we can take to the nursing students that we'd be teaching, to actually sit down with the families and do that graphing where they can pick out these medical conditions prior to, because all the kids are into this internet, and all the kids are into this, you can actually get them started into the genealogy and actually look at their parents, look at their grandparents, and kind of track a risk factor they have with these pap smears. And I think it should be up to them if they choose to have one prior to, because I know some females that are 35 years old that are not sexually active. So do they need a pap smear every 3 years based on what the CDC recommendation is saying? No, because they're not exposed.
This is true.
Yes, they have a risk, because if their first generation parent or second generation parent does have that disease, their risk is always there. But is the risk? Huh?
Come on, Donald. I'm sorry.
So I don't know. I think we need to take it back to the parents and actually the individual, and have them teach them how to research medical history and find out what their risk factors are, and if they are sexually active with multiple partners or different things, just to kind of show them the risk factors do incrementally increase if they are that way.
You have a good point about the family history. I think throughout this class, we have been talking a lot about how to take a good history in order to make sure that we treat the clients appropriately, because it would be different. It wouldn't be that much difference between somebody in age if they already had something in their family history that might include them in being maybe even a higher risk than somebody who's sexually active.
Because I'm sure that would open up a lot of communication with that family that says they are sexually active and they do have a risk. They need to get tested more often.
I find that to be true as well.
One of the big points that you all touched on, I think the big thing is getting the family talking. I've talked to so many families that don't know each other's history. They don't have a clue what grandma had or the aunt had or anybody in the family. If we could get down for that dialogue, we would be reaching several generations after we get that conversation started, and they recognize what may be a trend for their family.
But even if they don't know what their grandparents or what their parents have, they can start with themselves to set up the next generation. So they can start a new book with themselves instead of looking back at what happened. They can start fresh and actually get a better idea of what it is, and actually teach the kids, and hopefully get that ball rolling again where they actually sit down and explain it to them.
That's true.
Forward, definitely.
Well, I think we're leaning toward a conversation as well as to what about, let's say we have women who live untraditional lifestyles or alternate lifestyles. That should be the politically correct way of saying it. So even if I'm never with a man, what is my risk factor besides my family for, getting cancer? Because it would have nothing to do with my sexual partner per se.
But it would.
Mm-hmm.
Because what kind of intercourse do you have, if you have intercourse at all?
Well, I guess that's true.
Is it an oral base? Is it artificial base? Because you also have those risk factors also.
Mm-hmm. And what people don't realize, even like with HPV, you don't have to have intercourse, but just when various parts of the body and genitalia come in contact with the vagina without penetration, you can still pass on some of these disorders. And people think it has to be penetration.
Yep.
And they don't think about oral cancers, the oral HPV, those things that can be transmitted that way rectally and what have you, because they've been told, oh, the big thing is not getting pregnant, and if you don't do something vaginally or without.
But if it's the homosexual, I guess you could still use that term if it's politically correct. You still have the artificial penetration.
Yeah.
Is it sterilized or is it desanitized to actually be used?
That's a good point, because and then you know what? It doesn't even have sexual orientation may play a part, but another thing that I realized is that you remember a couple of years ago, or not, maybe it hasn't even been a couple of years, that the kids in college especially were doing things of sexual natures that they didn't call sex because they didn't look at it as them having sex.